Today we have with us Dr. Saravanan Sivanidhi. He is an experienced physiotherapist, and I would say an experienced pediatric physiotherapist. And most of us have not only worked with him, but also learned from him. And we are very happy to see the progress that he has made in life. And today he will be talking about robotics and especially the Lokomat. uh, he will be sharing his experiences. I would request all the participants to kindly mute. And at the end of the session, we will be opening for questions and queries. Dr. Subbu is also with us. He would be sharing his experience of using a Lokomat, and we would be glad to have his experience with us at the end of the webinar. Dr. Savanan, uh, we are pleased to have you with us today. Thank you for being here.
Thank you so much, Dr. Harpreet, for this wonderful introduction. Thank you. I'm happy to be part of this webinar. So today we are going to discuss very specifically about Lokomat. I had an opportunity to use Lokomat for 4 years in pediatrics, and that experience of mine is what I'm going to share along with some basic, stuff about Lokomat. Most of you might be aware. Some of you are probably not aware of what Lokomat can do, or might be having some kind of questions. So hopefully this presentation will answer all your questions and stuff. Okay, the pediatrics, what is written there is the UK spelling of pediatrics. So we all use the American spelling, where we take the A out and we put only PED. So what you see here is the UK spelling of pediatrics, which is PAE. All right. Okay. So Lokomat. So Lokomat is a robotic rehabilitation device that provides very highly repetitive and the most physiological movement in training. The Lokomat actually was a brainchild of engineers. The name of the engineers were Jerry Colombo and his partners Matthias and Peter. So the name Hokoma comes from their combination of their names, and they came up with this moniker when they were undergraduates in the late 1980s. In 1980s, and Mr. Colombo is an electrical engineer who was focused on biomedical technology in his studies at the Federal Institute of Technology in Zurich. He worked primarily with incomplete spinal cord injury patients who have some feelings and motor control below their injuries. He looked into ways to improve their therapies. It was around 1995, the team had the idea to develop a robot that could do manual treadmill training automatically. The company's chief executive officer is Colombo, and Lokomat was launched in the year roughly around 2000. So we are talking about a technological innovation which was almost 25 years back. And currently we have a lot of other players in the field as well, but Lokomat was the pioneer in getting this robotic rehabilitation into the field. So what does the Lokomat do? Put in simple terms, Lokomat will move the patient legs through the gait cycle in the sagittal plane. That's a very simple way of telling what Lokomat can do. So to go more about explaining it, Lokomat, what it does is it will have a hip and knee joint actuated by linear drives integrated into an exoskeletal structure. So the passive foot lifters will support the ankle dorsiflexion during the swing phase. So the challenges a physiotherapist faces while doing gait training, let's say even in a stroke patient, is that the active dorsiflexion is very difficult for the therapist to mimic while they are doing it manually. So the Lokomat very simply will address it with a foot lifter, and it will introduce that dorsiflexion during the gait cycle, particularly during the swing phase. So the intended use of the Lokomat is to increase the strength of muscles and the range of motion of joints in order to improve walking. And it also came into use in pediatric robots treadmill training with the Lokomat device in later, but initially they started with the spinal injury patients and then progressed to other conditions as well. The Lokomat exoskeleton comprises two actuated leg orthoses, which are individually adaptable to the patient's legs. And there are 3 cuffs to it, and the movements are controlled in the sagittal plane, and software adjustments can be made with respect to the range of motion, speed of the treadmill, body weight support, or guidance force. So all kind of adjustments can be made. I would like to talk about this guidance force later, but let me explain each of these terms. One is the range of motion, we all are aware that what kind of range of motion is needed for a very slow, steady walking or a fast walking or a running. So the range of motion can be increased and adjusted in the Lokomat. The speed of the treadmill can also be adjusted accordingly. The body weight support can be adjusted, like, fully supported, or what percentage of support is needed, what percentage of body weight the person can put in the legs. Those kind of things can also be done. And there is a guidance force also is available, where the force will be, like, for example, if you want the patient to start moving their legs, you can reduce their guidance force. If you want the patient, if you are going to give them the full guidance for, the patient will not be moving anything, the Lokomat will be doing all the job for them. Last mentioned is the supportive force of the drivers. If it is reduced, it allows the patient to participate more actively, as I mentioned, and experience more movement variability. The Lokomat device sensitivity determines how easily the Lokomat stops if there is a suddenly intermittent force or deviation from the desired gait. So that is also there. The Lokomat can sense if there is some kind of abnormality, and it will stop. It will not allow the person to walk with any abnormal way or position. So it will stop. If any deviation happens from the normal expected desired gait, it will stop. So this is a broader picture of what a Lokomat is. You can see that there is a dynamic body weight support, where you make sure that the person's body weight is being supported. You have a screen in the front that is called an augmented performance screen, where you have a lot of interactive games or other stuff which the service user can be doing, where they might be engaged while they're in the Lokomat. And there is the orthosis. I have mentioned two. One is the optional pediatric orthosis, which will be removed and fit according to the pediatric sizes. Then there is a treadmill down, and we also have the user interface there at the end, where we will set the data parameters which is required, and also the 3D pelvic movement which is there, which is required which we will decide according to what is the condition and how we can use it. So why Lokomat? The concept of task-specific learning based on neuroplasticity suggests that activities of daily living may be trained and improved through continuous repetition in neurological patients. Robotic Lokomat therapy meets this demand and enables intensive functional locomotion therapy with augmented performance feedback. You will be soon seeing a video where we will be seeing how the person is, being engaged, and currently how the person is walking in the treadmill as well. The functional movement and sensory stimulation play an important role in the rehabilitation of neurological patients following stroke, spinal cord injury, traumatic brain injury, as well as in patients with multiple sclerosis, cerebral palsy, or other neurological disorders. Administering intensive functional locomotion therapy with manual training requires sufficient staff. It is also, a lot of labor will be involved, and probably short training sessions, because as a human being, we are also having some kind of fatigability as a physio. Like, let's say that you support somebody and you are trying to move their legs. One physio sits on the left, one physio sits on the right, trying to move the leg on a treadmill supported. Like, you can do probably for 5 minutes max. Then your arms will start having that fatigability, because you are using your movement muscles, your hand muscles. You're using your movement muscles to move somebody's leg and the body weight. So automatically you might be tired, and this puts a limitation on your gait training sessions. So furthermore, manually assisted gait therapy can be challenging, especially in obese patients or overweight patients, and also patients who are spastic, where you need to apply a lot of force to move their extremities. And enhance motivation through patient-specific guidance force control that is there, because according to the patient's ability, as I said, we use the guidance force to calculate how much guidance is required, how much the patient can take, how much the patient needs a guidance. And patient assessment and documentation of the therapy progress is much easier with a Lokomat. The Lokomat consists of the robotic gait orthosis and an advanced body weight support system combined with the treadmill, as we have seen in the picture. So patients on a wheelchair can be escorted over a ramp onto the treadmill and are easily fitted into the Lokomat. It is easy for them to be fitted into the Lokomat. Like, setting up a Lokomat probably for a patient will take 5 to 7 minutes if you're good enough. If you're a basic user who have just started, when you're figuring it out, probably it might take some couple of minutes more. Maybe the max is 10 to 15 minutes for you to set it up if you're just started with using a Lokomat. So it is fast to set, and it is easy for you to start the session as early as possible. One physiotherapist himself or herself can manage it. So you don't need too many people putting their hands on the patient. One therapist herself or himself can manage. Computer controlled motors precisely synchronizing with the speed of the treadmill, moving the patient's leg through trajectories that will exactly mimic the physiological gait patterns. A convenient user interface allows the therapist to easily operate the Lokomat and adjust training parameters to suit the individual needs of the patient. So there is a user interface that will help the therapist to explore the possibility of adjusting the Lokomat according to the training parameter what he has planned for this particular patient. The automated operation relieves physical strain of the therapist and enables longer and more efficient therapy sessions. That's the key. Like, for example, if you want somebody to continue walking for some more time, Lokomat is the answer, where you are going to repeatedly give them the physiological gait input that is required. Because I have attended a lot of clinical courses. In one of the courses, my training instructor told me that if you want somebody to walk, you need to train them while they are walking, meaning that walking is an exercise cannot be taught by making somebody lying down and moving their legs. You cannot mimic walking. Walking needs to be in that plane, how they are walking. That is where your gait training should be. That is how I have learned from them. So gait training here makes it easy for the physical therapist who is working with this patient and makes it a more efficient therapy session. So the body weight support. So the precise dynamic body weight support optimizes the physiological gait training, because we need to understand how much this patient can take weight. For example, a patient with stroke or patient who have been, just had a transverse myelitis or any kind of, recent incidents, what kind of body weight they can take, how much body weight is the one which you want them to be supported. All these calculations can be precisely done with the Lokomat. The dynamic low inertia suspension system allows sorry. Sorry. Can I go ahead?
Yeah, please continue, sir.
Okay. So the dynamic low inertia suspension system actually allows a precise unloading of the patient and promotes a more physiological gait for optimized sensory stimulation. Continuously adjustable body weight support facilitates trainings for children and lightweight patients as well. So I have done extensively in pediatrics. So I will be talking about my experience later. But one of the good things is that Lokomat can be easily adjusted according to the patient, whether it is pediatric or an adult. Accordingly, we can definitely do it. And so it is this body weight support is the one which definitely helps us to make sure that what kind of the body weight you want the person to actually take and what kind of support is required accordingly. Automated patient lifting and unloading facilitates training and allows real-time adjustments during therapy sessions. The body weight support can be adjusted precisely to the patient's needs, assuring an optimal training environment. And also we talked about the augmented performance feedback that provides kind of a motivation to them. And also it is instructive and functional feedback in virtual environments. So to put it in context, what is the augmented performance feedback is, there will be a task for them on the screen where, like, let's say that they will be seeing a virtual figure who's walking. There will be some targets set for them. And if they are walking straight, they will be going in one direction and achieving their goals. Suppose they are deviating from the path, they have to adjust them accordingly. So that kind of motivation is also there. And there is kind of fun where people are, like, children enjoy a lot of video games and stuff. There will be games with a lot of encouragement and reinforcement, where the feedback is also happening. What kind of weight bearing is there, how many steps they took, what kind of body weight was given, and every feedback is also there from the augmented performance feedback. So the functionalities wise, the Lokomat is a physiological gait induced by relevant functional feedback. The functional feedback encourages patients' involvement in their therapy, engaging virtual environments to motivate the patients continuously. Intensity and level of difficulty are always adjustable according to the cognitive abilities and specific need of each patient you are treating. And various virtual environments are downloadable, like, plenty of games are there which are included, and movements, because you cannot make an adult play a child's game, vice versa. A child will not be able to play an adult game, may be boring for them. And you can also select characteristics. We have had one of the patients selecting a funny a caricature look of Elvis Presley, like an obese Elvis Presley, using this avatar, and they were making that Elvis Presley walk in the line and do some kind of stuff in that. So those kind of things are also there. You can select what kind of avatar you needed. You have a robo, you have some famous characteristics which you can use in your games. And movements required the patient are based on physiological and biomechanical principles. So I had an opportunity to use extensively something called Lokomat Pro. So the Lokomat Pro is designed to accommodate, there is two ones, Lokomat Pro and Lokomat Neo. So the Lokomat Pro is the one which is like with all the advanced characteristics and everything. Approximately a Lokomat can cost somewhere around between $200,000 to $500,000 approximately. So the Pro is the highest one. So approximately that is the cost. So what happens is in the Lokomat Pro, it is actually designed to accommodate adult patients with femur length of about 350 to 470 mm and pelvic width of 290 to 510 mm. And the pediatric orthosis one is designed to accommodate smaller patients with body height from about 86 centimeter, that is femur length of 210 to 350 mm and pelvic width of 170 to 280 mm. So what are the contraindications for use of, we talked about Lokomat, how it is used and how it is helping. There are some contraindications for using the Lokomat as well. So Lokomat training probably is not possible if you have a patient who has reduced bone density like osteopenia or osteoporosis. And for very much overweight and obese patients, training is contraindicated if they are more than 135 kg or they are taller than 2 meters, that is 78.7 inches, or than 1.95 meters, depending on the version. The Lokomat devices are also tested for persons up to 135 kg and 2-meter body height. Beyond that, it may not be possible. And Lokomat training is contraindicated even the person is underweight, like less than 10 kg. Lokomat cannot be used. If any non-consolidated fractures are there, any medical conditions that can prevent active rehabilitation, like any respiratory diseases, pregnancy, orthopedic conditions, cognitive deficits, limiting communication, neuropsychological conditions, infections or inflammatory disorders, osteomyelitis, and so on. Fixed joint contractures that can limit the range of motion of the orthosis. So any fixed contractures are there, Lokomat cannot be used because Lokomat uses the guidance force to move the limbs. So any fixed contractures are there, then it is contraindicated. A proper fit of the harness and the orthosis is very, very crucial. This is the point. If you are not fitting it properly, it can, it probably the machine will sense that that is some kind of an abnormal alignment. It will not function. Lokomat training is therefore contraindicated in patients with an upper leg length of less than 21 centimeters or more than 35 centimeters, or less than 35 centimeters and more than 47 centimeters in adult orthosis. So in pediatrics, it should not be less than 21 and more than 35. If you are using an adult orthosis, it cannot be less than 35 and more than 47 centimeters. So Lokomat training is furthermore contraindicated in case of the inability to properly adjust the harness or orthosis to the respective body part due to pregnancy, any kind of colostomy bags, or any differences in leg length, very much discrepancy there, or skin lesions that cannot be protected appropriately, or for any other reason that prevents a proper pain-free adjustment of the harness or the orthosis. The other risk factors is that Lokomat training should be immediately terminated as a consequence of any potentially dangerous situation arising from the following reasons or the risk factors like orthoplasty, uncontrolled hip, knee, or ankle stability, very poor head control, and head is falling in all directions. There is a head support which can be given, but a very poor head control is there. Lokomat might be a contraindication or probably a risk factor. So you need to consider consider it before using it. And joint contractures or limitations, as I already mentioned, due to spasticity, if any strong limitation of range of motion, difference in leg length correctable with an insole, sensory impairment in the lower limbs and trunk, especially reduced pain sensation, risk of autonomic dysreflexia, recent history or elevated risk of seizures, any cardiac instability or cardiac insufficiency, and uncooperative or aggressive behaviors, mechanical ventilation, long-term infusions, and skin lesions. These are risk factors. So you have to take into consideration, then take a call accordingly. So these are um, some videos. Just a minute. Let me stop sharing because I need to just a minute. Just bear with me. So these are the YouTube videos which are already there. We are not supposed to share any of the patient videos. So just let me know if you can see the video. Okay.
No, sir, not yet.
Okay. I'm going to share it now. Can you see the video now?
Yes.
Okay. All right. I'm going to play it now. Yeah.
There is no audio, only video we can see.
Sorry.
Sir, Saravanan sir, there is no audio actually.
Okay. Can you hear now?
Core muscles and experience physiological
Yes, we
balance.
can hear. Sir.
Okay. Thank you.
Thank you.
The leg orthoses are easily exchangeable. In less than 4 minutes, the Lokomat can be ready for pediatric patients. The 3D module is now available for use with the pediatric leg orthoses. Now children can also experience physiological weight shifting and hip movement during gait training.
Die Erfahrungen, die wir schon gemacht haben mit dem 3D Pediatric bei uns, ist einfach, dass das Setting viel bequemer ist. Also die Kinder mögen es, dass sie in der Beckenregion nicht mehr so stark fixiert sind. Denn 3D Kinderlokomat finde ich besonders für Kinder geeignet, die schon funktional etwas besser sind, die vielleicht schon etwas in einer späteren Phase des Reha-Aufenthalts sind, weil sie wirklich schon Übungen bezüglich Beinachsenstabilität oder bezüglich Gewichtsverlagern auf das Standbein einfach umsetzen können.
All right. You have one more video. Just bear with me. I have to cut and paste because I do not have YouTube in this one. So I need to cut and paste the link. That's why it takes some time.
No problem, sir.
Okay, this is the next video. If there is any issues with the audio, please let me know. Can you see the video?
Yes, we can.
Okay.
Door een virus in het centraal zenuwstelsel is motorisch alles verloren vanaf de mond. Rechts kon ze haar tenen nog bewegen. En voor de rest was er niets meer aanwezig. En daar zijn we nu mee bezig de afgelopen maanden. Om haar fysiek weer op been te krijgen. En de Lokomat Pro is hierbij een game changer.
Lokomat is een heel innovatief loophulpmiddel. Biedt ondersteuning daar waar nodig tijdens het lopen. Je kan gewicht ondersteunen, je kan de loopbeweging ondersteunen, afhankelijk van de diagnose en de beperking van de patiënt. De eerste keer dat ik op dat apparaat stond was wauw, dit is dus lopen.
Er is niet een mogelijkheid om die loopbewegingen ergens anders na te bootsen.
Ik loop op die Lokomat ongeveer in 40 minuutjes zo'n 23, 2400 stappen.
Dat haal ik nooit met mijn kruk.
En de looprobot heeft allerlei uitdagingen, challenges. Dat kan voor een kind een spelletje zijn waarbij een pinguïn moet springen. Voor de volwassenen kan dat iets zijn in de zin van proberen gelijke stappen te zetten.
De uitdaging die hier wordt neergezet, dat zet ze door thuis. Dus je ziet een stukje verbetering in de kracht, in de uitdaging. Ze durft meer.
Het is goed voor je de bloeding. Mijn spieren van mijn kuiten zijn gegroeid. Ik zwaai minder uit met mijn benen. En ik heb minder spasmen. Maar er zijn mensen die verlamd zijn. Er zijn mensen die hierop staan met een hersenbloeding. Mensen met MS, mensen met Parkinson.
En over het algemeen zie je eigenlijk bij iedereen toename van spierkracht. Maar ook van algeheel uithoudingsvermogen wordt verbeterd.
Waar we nu zitten, hadden we nooit van durven dromen een paar maanden geleden. Het resultaat wat je ziet, dat geeft weer hoop.
All right. So that's the couple of videos which I wanted you to see. Now we are going to go to the evidence part. So I'm going to share my slides again. Can you see the slides now?
Yes, sir.
Okay, great. So we're going to discuss the evidence. I've selected some couple of evidence which I believe is which definitely is something what we wanted to discuss today. So yeah, the first one is assessing the efficacy of Lokomat training in pediatric physiotherapy for cerebral palsy progress evaluation 2024. And this was conducted with a total of 26 children with CP between the age group of 4 and up to their 16, 17 years. And it was done by, I don't know, I'm butchering the name probably, but I'm not sure because we are really not sure how to spell these names. It's probably Michelina Blastwigs and Anna Hadamus. They concluded that there is consistent trend of increasing gait speed during therapy. So they are agreeing there. The body weight support also exhibited a decreasing trend throughout the therapy, potentially potentially making sure that the metabolic cost and muscle activation guidance force decreased steadily during sessions, with evidence suggesting it is improving the muscle activation and tracking the accuracy. Significant enhancements were noted in the distance covered and number of steps taken in the Lokomat training, indicating very positive progress in locomotor capabilities. So this was done in the year 2024, a recent study. Then there is a study which was done in 2022, particularly in children with ataxic spastic CP. 10 children were taken. The mean age was around 8.6, done by Rosaria, Miriam Bonanno, Carmela Setimo, Rosalia Murter, and Rocco. Concluded that use of robotic devices cannot be applied as a standalone, but can be added as an additional advanced and complementary training to CP standard neurorehabilitation. The third one was the effectiveness of robotic assisted gait training for pediatric gait disorders. A systematic review, which you know what a systematic review is, were done by Sophie Lefman, Remo Russo, and Susan Hillier. Concluded there is a very weak and inconsistent evidence regarding robotic assisted gait training for children with gait disorders. If clinicians choose to use this, they should make sure that the progress is monitored closely with appropriate outcome measures, including monitoring of adverse events. Further reasons using higher level trial design, increased numbers in specific populations, relevant outcome measures, confirm effectiveness, and clarify training schedules. To cut it short, they wanted a bigger trial to make sure that there are a lot of evidence created for robotic assisted gait therapy. And there is another one which is very interesting: the effect of Lokomat robotic orthosis system on lower extremity rehabilitations in patients. A systematic review and meta-analysis. This was done in China. So the review analyzed 21 studies with a total of 709 participants, found that use of Lokomat, especially in stroke patients, resulted in favorable outcomes in regard to balance. And however, the functional category scale showed that Lokomat was less effective than the CPT group. and also the gait speed and functional independence measure, there was not much of a difference. So what they are saying is there is ability for this to be used as a proper tool, because it definitely reduces the therapist's work intensity and burden. But future randomized controlled studies is needed to make sure that this is properly utilized. So I'm going to discuss about my experience. I had a lot of children. I have treated a lot of children in my experience with Lokomat, but I'm going to highlight only 2 people here because of the uniqueness in their presentation and the way they have progressed. So the first child was a 13-year-old regular school-going kid. One fine morning, suddenly had a high fever and felt lower limb weakness, rushed to the hospital. It was found that she had transverse myelitis, and she resulted in lower extremity paralysis, lost the bladder control as well. And so she came as an inpatient in the hospital setup where I was working. So we scheduled everyday physiotherapy session for her, because it's like, twice in a day we scheduled everyday physiotherapy session for her. And one of the session was always Lokomat. The other sessions are mixed with neurodevelopmental therapy, physiotherapy, strength training, exercise therapy, and also aquatic therapy twice in a week. So we did all our efforts were to make sure that the person starts walking, because she was only 13 years old. And this person started with our intensive therapy module. This person started standing and stepping in 4 weeks time. I was her therapist. So she started standing and stepping in 4 weeks time, and she started walking with a stick in 8 weeks time. So our intensive therapy program is only for 8 weeks, not more than that. So at the time of discharge, this person was actually walking with a quad stick held on one hand, and she's still continuing to walk and learning how to walk on her own. Of course, I'm not in touch with her, but I'm saying that this is how the patient was. The next one was even more an younger child, around 6 years old, had a traumatic brain injury, had a fall from the 3rd floor of a building, suffered serious head injury, was in the intensive care unit for a long time, was discharged and was brought to the pediatric rehab unit. She was wheelchair bound when she came. She also lost the ability to walk, speak, and also it affected the cognitive ability as well. So she was having some cognitive challenges as well, was not cooperative. She was agitated always, aggressive, crying. And so we scheduled the Lokomat session along with regular physiotherapy, strength training, and also aquatic therapy, like what we use for the patient A, we use for the patient B as well. So within 3 weeks of time, she started walking, uncontrolled walking for a distance of 10 to 12 feet. That's a fast walking, like, from point A to B, she will walk faster and reach. And it's more like surrendering at the point B. This was what she was doing. Then she started doing controlled independent walking later. And that was within the 4 week span, 4 to 5 week span of time. She started doing the controlled independent walking. And ability at the time of discharge was she was doing non-supported independent walking, and she's still continuing to walk. So these are 2 things I wanted to highlight. Why I say that is that intensive gait training was possible with the Lokomat. I know we all do all kind of therapy sessions. Aquatic therapy also helped. So because aquatic therapy is again an environment where the patient without a fear of fall can do all kind of other walking and exercises, the same thing. But the only thing is there the body weight is almost being subtracted. But in Lokomat, we can make sure that the patient can be given the necessary body weight. In aquatic therapy also, different levels of body weight categories we did. In Lokomat, the session was more intensive for more than 30-40 minutes. There's no comparison, but what I'm saying is we use the best of all the available therapies to make sure that the person walks. So it is in more or less, Lokomat was also an efficient tool like aquatic therapy and neurodevelopment therapy, strength training, or exercise therapy in getting the results what we were desiring to, what we desired to get for this both the patients. I also worked with a lot of children with cerebral palsy where the improvement was slightly better compared to, like, let's say we all know that spastic diplegic children always have an ability to walk, but they get tired and fatigued because of the way they are walking and their center of mass, how it is being placed. Because of that, they get tired, fatigued easily. Lokomat helps them to achieve that necessary gait cycle and gait strength which is required. So we have seen improvements in them as well. So why I wanted to highlight these two is because based on the evidence, yes, they say that Lokomat is effective, but larger trials are needed, and Lokomat can be an effective tool in the rehabilitation process. With my evidence, with my experience also, I definitely go with that evidence that says that Lokomat is a very necessary, useful tool for bringing the desired results. So the alternatives to Lokomat is what you see in the picture here. There is one called TheraTrainer Lyra. There is one called Lexo Robotic Trainer. There is one called Walkbot. Lokomat is original. It is like a superstar because that came into the picture, bringing in all the possibilities for all these companies to come up with cheaper versions. Because the Lyra is currently the one which is much more less costlier compared to Lokomat. Lokomat is definitely a very costlier version. For some people, it may not be affordable. So you can look at other options like TheraTrainer Lyra, or the Lexo is again the same one. It is a little costly and complex to set, but TheraTrainer Lyra is very simple and easy. And TheraTrainer Lyra does not have an interactive screen and stuff. It is more or less does the simple job of making a person repeatedly walk through the gait cycle. And also you have something called a Walkbot, which also helps the person to walk in the same way how the Lokomat works. Thank you. Thank you so much for this. I'm going to stop sharing.
Thank you. There was one question, I think Dr. Subrailu answered her about the exclusion criteria for accessing Lokomat, but
Yeah.
I think you already covered the risk factors and contraindications.
Yes.
So that can be shared later on.
Sure.
Thank you so much for sharing your experience, and we are open for questions if anybody is willing.
Yep. Thank you. Thank you so much. Okay, there is a question from Rashid. Hi, Rashid. Good to see you in this forum again. It's been a long time since I've met you. Long time, very long time. So your question is, how long does a session last on a robotic device, and how frequently do you ask the patient to take it? Children with spasm. So first question I will answer, then I will go with the other one. The first one is like, how long does a session? Depends on, because the person, the children or the service user, they take the call. The patient takes the call. The patient.
So this is the angle of entry in infants. Actually, this is 150 degrees angle in newborn. So it has to come down to 126 degrees for mature adults, like what we are like for the normal people. So it can take place only in the normal adults, not in the children. So most of the children will have the hip dislocation. To reduce that hip dislocation, we have added so many surgeries actually by using this Lokomat. Actually, there are few patients actually. So where we have avoided the surgery by using the Lokomat. This is the thing what I want